This is Veeresh Kademani from first year MS nursing student at SDM University, Karnataka. And I am also one of the registered nurse practitioner in India. And I am here will be running through some role play scenario based on the assessment, just to show you some of those situations you might encounter as you go out of clinical practices. To do this, I am going to present the patient and demonstrate the key steps in the part of history taking. Initially, I would like to explain the importance of history taking. History taking is the first step of health assessment. Start your assessment by taking a detailed health history to obtain a subjective data. The information you gather during the interview, it will help you to know the patient's actual or potential health problem, and also to make the patient feel comfortable and respected. Start with the open-ended questions. Open-ended questions gives more appropriate information and also allows the patient to speak freely. When you want to know about specific information, you should start with the closed-ended questions, which says yes or no. For example, do you smoke? No. We should be aware of the level of consciousness, which includes degree of wakefulness and orientation to time, place, person. So, let's begin with how the history is being collected accordingly. The main basic key components of history taking, which includes biographical data, chief complaints, history of present illness, history of past illness, history of present surgery, history of past surgery, family history, socioeconomic history, and personal history. So now let us talk about each component in the part of history taking, starting with the biographical data or patient profile.
May I come in, sir?
Yes, come in. Please have a seat. Hello, my name is Mr. Veeresh, registered nurse practitioner. Today I will be taking your health history. Is that okay with you?
Yes.
May I know your name, please?
Yeah, my name is Ajay Kumar.
Okay. Alright. How old are you?
I am 30 years old.
What is your qualification?
I am graduated in engineering.
That's great. What do you do for a living?
I am software engineer and I work in a company.
That's excellent, sir. Are you married?
Yeah, I am married and I have 2 children.
So, by the way, will you tell me which religion and caste you belong to?
I belong to Hindu and my subcaste is Lingayat.
Okay. So, may I know your residence address?
I live in a small town known as Balkapur in Haveli.
Okay. Please, can you show your OPD number?
Yes.
So, your registered OP number is 57112. Well, before we start about your health history, I just want to confirm your details. Mr. Ajay Kumar, 30 years old male patient, came to the clinic on 9th December 2020 with a registered OP number 57112, and he is a married man, resides in Haveli, and is a software engineer. Is that okay with you?
Okay.
So now, while collecting chief complaints, word card acronym is a useful tool for exploring each of the patient presenting symptoms in more detail. It is most commonly used to explore pain, but it can be applied to most other symptoms, although some of the elements of word card acronym may not be relevant to all symptoms. So, word card acronym expands O for onset, L for location, D for duration, C for characteristics, A for associated manifestation, R for radiation, T for treatment. So, let us begin with the chief complaints. Now I will follow word card acronym. The questionnaire should be framed like this. Tell me, Mr. Ajay, how long did you have this cough?
It was for about 7 to 8 days and has not got reduced.
Can you locate me the area that hurts you?
The pain is mostly in the throat.
Okay. How long does the pain last when it starts hurting?
Every time when I wake up during the or night times, I get the pain for 3 to 5 minutes or more.
Okay. Please, can you describe your pain, whether it is sharp or dull or more an ache?
It is wet and painful.
Okay. What are the other symptoms associated with your cough, such as stomachache, fatigue, breathlessness, etc.?
Yes, I feel nausea and stomachache when I cough, and it also have headache and fatigue. Yesterday I got temperature of 100 degrees moment.
Okay. Is it relieved by sitting forward or sitting?
I am okay when I am in sitting position. I get a breathlessness and more cough in resting position.
Did you follow any home remedies for your cough?
Yes, I have taken a cough syrup and also some home remedies such as tea inhalation, lemon tea, and for headache, tablet posing.
Okay. Well, before we start about your history of present illness, I just want to confirm your details. So, Mr. Ajay Kumar came to the clinic with the chief complaints of cough with mucus secretion since 8 days. The radiation of cough increases during night in resting position. He also complains of fever with temperature 100 Fahrenheit and headache since yesterday. Is there anything to add in this?
No, sir.
History of present illness is a summarization of chief complaints which can be elaborated as Mr. Ajay Kumar was apparently alright 8 days back. Then he developed cough with mucus secretion, which is whitish in nature, and his cough increases during night time in resting position. He got fever which was sudden in onset, that is 100 Fahrenheit, relieved on taking medications. Patient also complains of headache since yesterday, and he has history of generalized weakness and pain in the throat. And my client has no history of vomiting, no history of blood vision, no history of diurnal variation, no history of runny nose or any allergies. And this is your present health history. Is there anything to add in this?
No, sir.
So let us move on to past medical history. Mr. Ajay, do you have any past history of health illness like asthma, stroke, numbness, heart problems or any congenital health problems?
No, sir.
Have you ever been hospitalized?
No, I have no such history of medical illness, so I was not being hospitalized.
Do you have high blood pressure?
Yeah, I have high blood pressure.
So you are hypertensive. When was it diagnosed?
It was diagnosed 2 years ago.
Is it well controlled?
Yeah, it's controlled because I am on medication and I am consulting my doctor regularly.
Okay. When was your BP checked last time?
It was checked about 2 weeks ago and it was 130/80.
Okay. Oh, that's great then. What about your diabetic? Are you a diabetic?
Yeah.
When did you got diagnosed diabetes mellitus?
That was about 3 years ago.
Okay. Okay, when was your last checkup for diabetes mellitus?
I had done it the same time when I had checkup with BP.
Well, I just want to move your alarm a bit further as I know you have high blood pressure and you are diabetes. Do you take any medication for that?
Yeah. I take the tablet alone 5 mg or once in a day before breakfast and tablet metformin 500 mg or twice in a day.
Okay. Well, before we start about your health history, I just want to confirm your details. Is that okay with you?
Yeah, that's it.
Accordingly, my client Mr. Ajay has past history of hypertension and diabetes mellitus since 3 years ago, and also he is on medication tablet Hemlock 5 mg and tablet metformin 500 mg. And my client have no history of any childhood illness, no history of respiratory illness, no history of thyroid problems, no history of HIV infection or any injuries or accidents. Is that correct?
Yes, sir.
My client Mr. Ajay is presenting minor signs and symptoms of cough and doesn't need any present surgical intervention. So hence the present surgical history is nil. So let us move on to the past surgical history. Okay, Mr. Ajay, have you undergone any surgery before?
Yes, sir. I underwent an operation 20 years back.
Okay. May I know the details of your surgery?
Of course, sir. I had undergone appendectomy 20 years back and I was hospitalized there for 4 days.
Okay. So let us move on to family history. Mr. Ajay, which family do you belong to? A nuclear family or a joint family?
I belong to a nuclear family where I live with my wife and 2 children.
Okay. Do you have any history of hereditary, congenital or any disabilities in the family?
No, I don't have any history of disabilities.
Okay. So now let us formulate family tree on the basis of information given by Mr. Ajay Kumar. Mr. Ajay Kumar belongs to a nuclear family consisting of 4 members. These are client wife, elder son and younger son. So let us move on to socio-economic status. If you don't mind, Mr. Ajay, can I ask your socio-economic background?
Yeah, sure.
What is your income per month?
I earn 20,000 per month.
Okay. What languages do you know?
I am familiar with my mother tongue Kannada, and I also know English and Hindi.
So let us move on to personal history. Mr. Ajay, how many times a day you brush your teeth?
I brush my teeth twice in a day when I get up early in the morning and before going to bed at night.
Okay. How many times a day you take shower?
I bath once in a day.
So let us see about your dietary pattern. Mr. Ajay, which pattern of diet do you prepare?
I am pure vegetarian.
What do you add to your menu every day?
I will be like roti, chapati, rice, naan.
How many glasses of water do you drink per day?
I drink 1 to 2 liters of water per day.
May I know about your sleeping pattern? Like how many hours do you prefer to sleep?
I sleep 8 hours per day.
Do you take any medication for your sleep?
No.
So let's know about your elimination pattern. Is your bowel and bladder elimination regular?
Yes, sir. It's normal and regular.
Okay. Next we'll see about your activity and exercise pattern. What is your daily routine? Do you exercise?
Yeah, I go for walk in the morning and I perform some moderate exercise.
Okay. That's good. Do you have any problems in your joints?
Yes, sir. I have pain in my joint.
So let's know about any habits of substance abuse. Do you have habits of any substance use such as alcohol, smoking or any drugs?
Yes, I smoke and I also consume alcohol.
Since when did you start to smoke and consume alcohol?
It has been several years. I guess it may be more than 10 years.
Well, how many cigarettes do you smoke per day?
I smoke 2 to 3 cigarettes per day.
What is your intake of alcohol per day?
I take 90 ml per day.
Okay. It's not good for your health. Please start to reduce the things.
Okay.
What do you drink normally?
I drink PC.
Therefore, to summarize the personal history, Mr. Ajay Kumar maintains his adequate personal hygiene by brushing and bathing every day. He is a vegetarian and prepares roti, sabji, rice, dal for his meals and consumes nearly 1 to 2 liters of water per day. So also he maintains 8 hours of sleeping pattern without taking any pills. He has normal and regular bowel and bladder pattern. He does moderate exercise and goes for walking every morning. He is addicted to smoking and he is an alcoholic too. He smokes 2 to 3 cigarettes per day and takes 90 ml of alcohol per day. Is that correct?
Okay, sir.
Okay. Consequently, to sum up overall part of history collection, Mr. Ajay Kumar, 30 years old male patient with the registered OP number I8712, who is basically from Haveri, is working as a software engineer. So Mr. Ajay Kumar came to the clinic with the chief complaints of cough with mucus secretion since 8 days. The radiation of cough increases during night in resting position. He also complains of fever with temperature 100 degree Fahrenheit and headache since yesterday. There is no history of vomiting, blurred vision, diurnal variation, runny nose or any allergies. He is also known case of hypertension and diabetes mellitus since 2 years ago. He is on medication tablet Kamlong 5mg once a day and tablet metformin 5mg or twice a day. Mr. Ajay has a past surgical history of appendectomy which was operated 20 years back. He belongs to nuclear family consisting of 4 members. His income to the family is 20,000 per month and speaks Kannada as a mother tongue. Mr. Ajay Kumar maintains adequate personal hygiene by brushing his teeth and bathing every day. So also, he maintains 8 hours of sleeping pattern without taking any medications. He does moderate exercises and goes for a walk in the early morning. He is addicted to smoking and is an alcoholic. He smokes 2 to 3 cigarettes per day and takes 9 tablespoons of alcohol per day. To ensure good health, eat lightly, breathe deeply, lie moderately, cultivate the cheerfulness and maintain interest in life. By this I conclude the clinical history taking.